Hello. If you are bothered about little fine lines forming around your mouth area, this is what is called as perioral wrinkles or perioral fine lines. What are the reasons for these lines? Very common reason, a person who is very happy gets a lot of laugh lines because of the movement, constant movements of the lips where the skin folds. Second, due to sun damage, very fine lines are formed here on the skin which adds on to it. Third, smoker lines. Usually you will see very significantly on the upper lip of the patient where vertical lines will be formed. These are called the smoker's lines. Fourth, due to aging, this area is very thin. So the collagen loss and the elastin loss in this area leads to very early wrinkles in this area, and many people have the concern regarding this. So what to do about it and how to treat it? First question is, how can we prevent these lines from happening? And the second thing is, if you already have got these lines, how to improve them? So how can we prevent them from happening is applying a good sunblock, preventing from the sun damage and avoiding the lifestyle factors like smoking, keeping yourself well hydrated. If you have already got these fine lines, how to go about it? Multiple ways in which these lines can be treated. So one very effective thing is the laser. If you have very minimal fine lines and mostly due to the scrunching of the skin, a resurfacing laser like CO2 which gently resurfaces the upper layer of the skin does wonders. Second is, if you have got the smoker's lines or the deep perioral lines here, two things can help you very well in that. One thing is fillers like hyaluronic acid or skin boosters. These gently stretch these lines and also incorporate the collagen induction in those lines so that the area around this looks improved and fresh and stretched so that the lines are less visible. If you have very prominent lines, especially in the lower part of the perioral area, threads also give you a very good improvement. Now patients tell me, doctor, it is little confused. So how do I know how to go about it and which procedure to seek? So I am here to help you. Looking at your condition and why are you getting lines and how are these lines and entire the skin condition and everything, we actually advise you what is the best treatment for you. Either it is laser or threads or skin boosters or skin fillers. Doing any one of them or incorporating two or three of them, which will have a synchronized effect depending on how your perioral lines are. These will improve your condition around your mouth. How can you keep it long lasting from your side? So what I told earlier, improve the hydration always, use the preventive sunblock and the moisturizers which are ceramide infused, etc., which will improve the condition of the skin, and avoid smoking if you are a smoker. So that's how you can avoid from your side and come to us. We will help you in improving these lines and keep them like that so that the perioral area improves and your laugh and smile is always maintained without giving you any unnatural and unwanted lines.